those of you that struggle to last long in bed, you might want to watch this interview, because what this physiologist is about to say is going to make some of you really, really excited. This is the Luckydudu experience.
Any man who can last within 3 to 7 minutes, that man is very, very, very okay. Nothing is wrong with him. You must not last for 1 hour, 2 hours before you know that you had sex.
Sir, you say you feel pity for those that take Viagra. Why did you say that?
Yes, I feel pity for people that take Viagra. Why? Because Viagra basically is a medication that is not meant for everybody. The Viagra is meant specifically for those suffering from erectile dysfunction, which simply means that those are men that their penis can no longer stand. So Viagra is being given to them basically just to stimulate the erectile tissue so that the penis can also stand again. Now, when one is given Viagra, when Viagra enters into the bloodstream, it relaxes muscles of the blood vessels, thereby increasing blood flow to a particular area. For Viagra, it will increase blood flow to the penis. So that causes erection. That's what Viagra is basically meant for. That's the function of Viagra, to increase blood flow to the penis. That's what it's meant for. But a lot of people are abusing this medication, and it's bringing up a lot of side effects.
Like, what kind of side effects are we talking about?
Okay, now when you take Viagra, you might have side effects like headache. You might have side effects like dizziness and blurred vision. Because when you take it, there's a way you feel, especially when it is not metabolized properly or when it is not used from the body. I'm going to bring a scenario now. Now, the reason why some people take Viagra without medical prescription is the fact that you might have a girlfriend that have told you that you don't last long on bed. You will feel so discouraged. So the best thing for you to do is like, okay, fine. Since my girlfriend already told me I'm not lasting long on bed. Okay, let me go and get this medication from the pharmacy. And when you go, you get it and take it. When you take this medication, as the medication enters into your bloodstream, it just takes time before it starts into action. When someone consumes Viagra, it can take about 30 to 1 hour before it is absorbed into the bloodstream. So that is to say that, for example, now if you happen to take Viagra and the next 5 minutes and you want to engage in sexual intercourse, which is coitus, you might end up feeling disappointed because it has not absorbed into the bloodstream. So you can't feel the effect in the blood vessel. You can't feel the effect. So a lot of people take it because their girlfriend or their partner would have told them they don't last long on bed. So the best thing for them to do is go and buy Viagra and use it. Now, another thing that makes people to also take Viagra without medical prescription is the fact that they are suffering from maybe over excitement. Okay, now you met a girl online, you'll be talking for a long period of time, and you feel that you're going to meet her in real life. 2 people happen to meet. Then she was like, you look so cute and handsome. I hope you have energy in bed. I hope you can perform. Not knowing that you're not good. Then you now feel like, okay, fine. I think this girl is coming to my house. Let me go and buy Viagra and make sure that I impress her. She don't feel disappointed. So that's another reason why some guys out there also go to take Viagra too, which is not supposed to be so.
To create the first good impression.
Yes, to create good impression. Just imagine Mr. Joseph have big muscle and is vibrant, and on the other side it does not go well. So that becomes a laughing stock. So that's why some people engage in taking the Viagra. Maybe somebody have told them something that have pushed them into taking it, but it's not supposed to be taken like that, because medically it's supposed to be prescribed by your professional medical doctor based on the fact that you are actually suffering from erectile dysfunction. So another side effect you can see is blood vision. When you take it, you might be having blood vision, meaning that you might be seeing as if the places are moving, but they are not. You might have profuse sweating when you take it. So when you are performing the activities, before you know it, you start sweating profusely. You might also be having pains on your joints. So another one is more like musculoskeletal pain on the muscle and pain on the back. So you also feel it when you take Viagra. Those are some of the things we need to have in mind before thinking of taking it, because it has, as you are growing older, you start having problems with vision. Okay, you start having eye problem. Why? Because the area for sight in human is at the back of your head. I don't know if you're aware of it.
No, I'm not aware.
This is the occipital, the back of your head. That's where the striated area for vision is located. So that's why you discover that when somebody have an accident and fall to the ground and hit the back head, the first thing that will be affected is vision, is the sight. If you have an accident and hit by the side close to the ear, that's the temporal lobe. You'll be having problem with your hearing. So those things are things we need to know. Why? Because when you take Viagra, your vision might also be affected as you are growing older with time. Yeah. So I will always advise young adults or those growing up should avoid the use of Viagra, especially when they are not having any medical related problem like erectile dysfunction. They should avoid it. They should avoid it. And this will also bring to the fact that there are many reasons why some guys don't even last long. Yes, over excitement. You are too excited, you have met her. Before you know, you people engage and you have 5 seconds, 10 seconds, you have released. Over excitement can be one of the factors. Then anxiety can also be a factor too. Why some men don't last long? If they don't last long, their mind will be tuned to taking Viagra. So anxiety is one of them. How does anxiety work? One, the fear of the fact that you may end up contacting sexually transmitted infection. It will make you to come fast, to ejaculate fast as a man. Because you might not know the person too well. Maybe you met on social media, or it's a random girl you just picked. So you are scared. Before you know, you are so much afraid and you have released. Another thing that anxiety can cause is what we have to, we call the fact that the condom burst. If you want to engage and you know that the condom, you are already having this fear in mind that this condom is going to burst during the process, doing penetration. If the condom is going to burst, that fear alone will cause you to release faster. There are many reasons why the use of condom is not 100% safe. One reason is the fact that if the condom is expired, before you know, it's leaking. Another reason is the fact that if a lady should shave before sex, before coitus, sexual intercourse. Now imagine Amaka want to meet John tomorrow. Amaka have gone to shave, right? Unfortunately, John said he's traveling to another state. He will return in 2 weeks' time. After 2 weeks of shaving, you know that the new hair that are coming, they are very sharp and thick. And some guys like using this fact that during coitus, doing knacking, let me use that word, doing knacking, they will want to use the to flap on the mons pubis. The mons pubis of a woman is that area at the top where hair used to grow. So try to do that act alone. The sharp edge of those sharp hair growing can also pierce through the get it busted. And before you know, you end up getting her pregnant, and you'll be wondering, I use condom. That baby does not belong to me. So that's another factor why it is not also, use of condom is not so safe. So anxiety can play a role why some men always 5, 10 seconds, 60 seconds, they are out. Then men that also take excess of sugary substances. I will ask you now, what's your favorite drinks? You tell me Coke and Pepsi. I will ask you, what's your favorite snack? You will tell me it's cake. Now, as you are consuming this cake, are you exercising? If you don't exercise, you are not metabolizing those sugary content from your body. So that's why exercise is needed. So if you're in your house, at least have a TMT, treadmill, like the one I'm seeing in front of me, to burn out some calories, because it's going to help you a lot. So the best way of how you can, work towards the fact that you can control yourself or to even last better is via exercise. So you do your exercise, you do diet modification, you modify your diet. It's also going to help a lot. And also do exercise. Instead of telling young guys going to take Viagra, why they not take watermelon?
Does watermelon help?
Yes. Watermelon helps a lot. How does it work? When you start taking watermelon, make it as if it's a therapy to you. You can use it for like 1 month straight up as a regular therapy. Now, watermelon contains what we call an amino acid called citrulline. And this citrulline also helps in the formation of one particular amino acid in the body again, called arginine. Now, it is this arginine that is used to produce nitric oxide. The nitric oxide in your body is what is responsible for increasing blood flow to the thereby improving sexual performances and physical activity. So why won't you use watermelon? instead of going for Viagra, that you know quite alright that it has side effects that's going to affect you in the nearest future.
You are saying so much. Everything you are saying right now, has it been scientifically proven? I would like to know. I would like you to tell the viewers what your professional background is.
Okay, my name is Charles Ode. I'm a certified physiologist, and I graduated from the University of Calabar Medical College, where I had hands-on clinical experience in internal medicine, where I do more of ECG, electrocardiography, meaning that I work with patients with cardiovascular diseases, heart problems, and respiratory problems. So those are my major areas. So I'm just everywhere when it comes to clinical settings.
So how do you know so much about this topic?
Yes, I know so much about this topic. Why? Because while I was still in school, in medical college, my course, Physiology, is a broad course.
What's physiology about for those who don't know?
Okay, for those of you who don't know what physiology is the study of the normal functioning of the body system. How your body works, how your brain works, how your kidney works, how your liver works, everything that entails it. That's why we have different areas like cardiovascular physiology for the heart, renal physiology for the kidney, and we also have respiratory physiology for the lungs, and gastrointestinal physiology for what the opening from your mouth down to your anal canal. I also have neurophysiology, that's for the brain. So we have diverse areas in physiology. So while I was still in school, when we were taught about reproduction, so we have reproductive physiology as well, and neuroendocrinology. So during the fact that I was taught reproductive physiology, all those things were mentioned. Sexual acts, how does erection start, how does ejaculation start, what to do before you engage in coitus, before you start intercourse. So all those things we are taught, and I know how it works very well.
Impressive. What are some of the other things people can do to improve their sexual performance or their sexual life?
Okay.
As a man.
Okay. As a man, apart from the fact that I already stated that Viagra is not meant for you people, so especially for people having erectile dysfunction. Now, if you want to improve your sexual life, number one is communication. You and your partner must be able to communicate with each other. It does not depend on how long the sex lasts. It depends on how far both of you are satisfied. That's the major thing. So if you can last for 3 to 7 minutes as a man, and your partner is okay with you, then you people are good to go. You must not last for 10 minutes. You must not last for 1 hour, 2 hours before you know that you have. So exercise will be of a great help to you if you want to improve your sexual life. So in case you live a sedentary lifestyle, meaning that you eat, you drink, you go to bed, you sleep. Next day you eat, you sleep, and go to bed and sleep. It won't help you. The best thing for you to do is have a regular exercise routine where you go for workouts, for jogging, for strolling, at least burn out some calories, because when you do exercise, you become more flexible and more light. So it will also help your sexual lifestyle. And also, as I earlier said, lifestyle modification also matters too. Modify your lifestyle. Modify your diet. If you are the one that consumes excess of sugary substances like Coke, Pepsi, Fanta, you can limit them. Okay? You can limit them. Do more of fruit. Yes, do more of fruit because they're going to help you. They are antioxidants. They contain antioxidants. So they are going to help you a lot. So you can modify your diet. You can do exercise. And also, you can try as much as possible to see how you can, practice more of other exercise like stretching, squatting, anything that help you to burn out calories, to burn out fat from your system can improve your sexual lifestyle.
Interesting. Well, as somebody who has been in the clinical field for some time now,
okay,
what are some of the common complaints you've had to hear from women, ladies, about sexual performance that people don't really talk about online?
Okay, regarding ladies, it's more like there are some women that are suffering from low sex drive. Okay, a lot of women suffer low self drive, which could be the fact that this has happened due to their past relationship, or it could be it can be to maybe a rape case event. A trauma while they were growing up. So it changes their mindset regarding sexual activities. So some ladies also complain about that I don't think I'm good on bed and all of that because of low sex drive. Their desire for sex is very low. Why? Because of the traumatic experience they have had in the past. So complaints like that also comes in, but it's not basically pronounced like for the men.
I have a question. What about ladies that don't get wet? What could be the reason for that?
Okay, now if a lady don't get wet, number one, it could be the fact that there is fluctuation in a hormone called estrogen. Estrogen is a female sex hormone. That estrogen is one of the major hormones in the body of a woman. The same estrogen is responsible for the fact that when the level begins to decrease as a lady is growing older, as she enters menopause, it simply means that the estrogen level have completely dropped. And the first sign of somebody in menopause is dryness. At this particular time, if she's suffering from dryness, the best thing she could do is that maybe she go see her doctor. Her doctor might end up prescribing synthetic estrogen cream.
I'm even talking of young ladies. So
okay, now
like some people in their early 20s.
Okay, ladies in their early 20s, it could be fluctuation in the hormones as well. That's why you see that a lot of ladies are suffering from hormonal imbalance. Estrogen is a hormone. If there's a fluctuation in this hormone, it can also affect them to have dry vagina as well. You can see a lady using Vaseline to stimulate herself to create lubrication, or KY jelly to also create lubrication. Because if they are not lubricated, doing penetration is going to be very painful. And if care is not taken, the canal will be damaged. And that can cause trauma and also pain. So a lot of ladies at their maybe 15, 16 and all of that, who are suffering from maybe vaginal dryness, could be due to fluctuation in the hormone level, the estrogen hormone.
So such person should see a doctor?
Yes.
They should not be shy about it.
Yes.
See a doctor. A lot of people don't know how to approach doctors to go discuss things like this. So what is your advice for people like that?
Okay, if you're watching me right now, if you're the type that always feels so shy to approach your doctor because you have health-related problems, I think this is not the time for you to be shy. Why? Because it's your reproductive health. If anything is wrong with your reproductive health, which simply means that there's going to be a problem for you in the nearest future. So if you have issues like this, change your mindset of what people are going to say or what your friends are saying. Go and visit your doctor, and your doctor will find a better way of helping you out. Then you feel much better.
I wish there's a way people could, conceal their identity to go see doctors. I was speaking to a friend of mine. She went to see a doctor, and she said that while the doctor was examining her, she laid on the table
Couch.
and then he started sexualizing her. The doctor was even trying to touch her inappropriately.
Okay.
Yeah, so I don't know if that's something some of you have experienced with doctors, and maybe even because of things like this, some of you don't feel so confident to approach doctors to discuss about sensitive things. Maybe if you had just malaria and typhoid, you'd be confident to speak to your doctor about it. But if it has to be something that has to do with down there, like if a doctor says, okay, can I see?
Okay.
Like, you're a big girl, do you understand? You're an adult. How do you start, showing a doctor what is down there? So it becomes shameful. And because of this, people have to deal with their problems privately, and some people just turn to social media for medical advices, and that is not a very good
It's
thing.
not a very good
So
thing.
from your experience, are there other ways people could approach doctors to talk about private or sensitive topics concerning their life?
Okay, why do you think that sometimes when you come to the hospital, but the fact remains that when you come to the hospital or you want to approach a doctor, like for example now, if I am teaching on TikTok, for example, and maybe I'm discussing about maybe a particular topic, and you are part of my live stream and you watch and you are learning, and you'll be like, please, how can I talk to you? Now, the best thing I will do for you is telling you to send me a direct text message. Send me a direct text message will give me a link to see I can link you up to a hospital where you can see a professional medical personnel. So most of my videos and content on TikTok are basically for informational and educational purposes. So I'm not a medical doctor.
Okay.
As I earlier said, I'm a certified physiologist. So I can't give prescription. I can't tell you, okay, this is what is wrong with you. Okay, this is what you should do. No, I don't do that. So the best thing you need to do, I can do for you, is just to recommend you to go to a hospital and see your doctor.
What's your TikTok handle?
Okay, my TikTok handle is Flying Physiology, but what I was using on TikTok before was Doctor of TikTok. That was the name I was using on TikTok.
What of Instagram?
Charles Ode.
Charles
Ode. My complete name. Then on Facebook, my complete name, Charles Ode.
Okay, so editor, please put his social media contact in case there are people who might be interested to reach out to him.
Okay, look, as I was saying, I was bearing Doctor of TikTok on my TikTok account, but something just happened recently. Last week Thursday, I was having a live stream on infertility. So somebody came to my life. I think maybe it could be a medical doctor. I guess so. He was like, "What I'm teaching is a lie." But a lot of people are learning, quite all right. The reason why I can have 17,000 followers is because people love my teaching and they learn from it. As I earlier stated, my contents are basically informational and educational purposes only. So he came to the live. He said, I'm telling them what is not true. He sent a request to me to join my live stream for like 3 times. I declined and I blocked him. The next day, I saw myself on Nigerian Doctor on Twitter. I'm the one trending online right now as I'm talking to you. That there is one Charles Ode that studied physiology, pretending to be a medical doctor from University of Calabar. Of which, when I saw my friends saw it. I have friends that are still in school studying medicine in University of Calabar. They sent it to me on my WhatsApp. I say, Charles, Alpha, what's going on here? I say, this is what I'm seeing. To even me, I'm confused. Do you understand? So what I'm trying to say in essence is that for peace to reign, okay, I decided to change my TikTok handle to Flying Physio. At least when you come to my DM, to my bio, you see physiology there, content creator there. At least you are sure you're talking to a physiologist, not a medical doctor. I would also like to clear the air as well that I do not study MBBS in school. I study paramedic course called physiology, and it's a 4 years course.
Did you at any point put all this information?
Yes, the first one I put as when I was using Doctor of TikTok, I put in my bio, online health classes. I also written cardiological sciences.
But you never for once did anything deceptive?
No, I've not. Yeah. So
your videos just attracted people who felt you were not in the position
exactly
to speak about things like that.
Yes, and some of them saw my videos when I'm in the theater too, because the hospital I work right now, I have the opportunity to follow them to theater to look at surgeries like tonsillectomy when they are removing the tonsils. I saw a lot of and all of that, and I can promote health content as well, like talking about, okay, in case you have ear, nose, and throat problems, you can actually visit us in our hospital in case you want to see a specialist. Yeah, I post something like that as well. People came, saw the videos, and they actually felt like, okay, this guy that studied physiology in University of Calabar, now he has now become a medical doctor. How?
Doctor online.
That's what is trending right now as I'm talking to you.
Okay, so ladies, if you are experiencing things that you are not confident enough to discuss with your partner, your parents, or your friends, find a way to speak to a doctor about it. And people are scared for so many reasons. Do you understand? So you just have to find a way to discuss with you, because sometimes I also receive certain kind of messages.
Okay.
Especially after having sessions like this.
Okay.
You see people coming out to say, oh, they need someone that they can trust, someone that they can speak to. Do you understand? So these are some of those experiences. Anyway, just look around. If you find, maybe you can talk to a female doctor. But I think there was an app somewhere that you could speak to a doctor somehow. I don't know.
Okay.
So maybe it's easier that a doctor is expecting you because he already knows what your problem is, instead of coming from scratch and now telling him, he's looking at your face where you're saying it and everything. Anyways, hormonal imbalance. Is that the same thing as PCOS? PCOS?
No. Yes, PCOS has to do with what we call polycystic ovarian syndrome. Okay, PCOS can cause infertility, and when a lady has PCOS, she might end up having fluctuation in her menstrual cycle.
What causes that PCOS of a thing?
The cause of PCOS itself is unknown. Okay, but what happens here is that for PCOS to occur or to happen, it simply means that the ovaries which are part of the major reproductive structure in the female. The ovaries that produces estrogen and progesterone, the same ovaries releases eggs during ovulation. So at this particular point, now, if PCOS want to happen, it means that those ovaries are producing large quantities of androgens, of hormones, which are not supposed to be like that. So when the ovaries are producing large quantities of hormone, they now start affecting menstrual cycle and thereby causing anovulation, meaning the absence of ovulation. And as a woman, if you are not ovulating, you cannot conceive. If you are not ovulating, you cannot conceive. You find it very difficult to conceive. That's still another problem. So polycystic ovarian syndrome is something that happens, and if you're suffering from it, that's why you need to see your professional medical doctor. Go see a gynecologist. Talk it out. And if you're suffering from hormonal imbalance that is taking longer than usual, please, the best thing for you to do as a woman or as a lady watching me out there is to go and see your professional doctor. And he might recommend you for hormone profile testing, where they get to check your estrogen, your progesterone, and other hormones in your body system to see which particular one is responsible, is causing it. So that's how it works.
So all these things can be fixed, right?
Yeah.
Even the man that has his weak erection, premature ejaculation. What else again?
Weak erection, premature ejaculation. If you are experiencing that, why not? You go and see your doctor. Okay, if there's a need for them to give you medication to work on maybe erectile dysfunction, they can. But one thing with that medication is that the effect is a temporary effect. The effect of Viagra or whatever is a temporary effect. It's not permanent.
It's not a long-term solution.
It's not a, yes, it does not have a long-term duration. As I earlier stated while I was talking, when you take Viagra, it takes 30 minutes to 1 hour before it enters the bloodstream. Now, that thing can last in your body for 5 hours after you've used it. It can still be in your bloodstream for 5 hours. Now, how do you get rid of it? If you take Viagra, for example, and maybe Amaka fails to come and visit you, advice, please be drinking a lot of fluid. Drink plenty of water so that you'll be urinating. We call it micturition, passing out urine. So you go to micturate, you pass out urine frequently so that you can get rid of the drug effect from your body through the urine, or you can do exercise to sweat it out. Or you can use the what's it called, the toilet, so you can defecate. Then those are some of the ways you can excrete substances from your blood, through sweating, through defecation, and through micturition. You can pass them out. So in case you are a victim of that and you happen to take it and the person you're waiting for does not come, please help yourself by taking water. Drink too much of water. It will help ease you.
Can I say something?
Okay.
There are a lot of people that don't know what's premature. There are a lot of people who don't know what's this thing? Erectile. What's that thing called? There are a lot of people who don't know what quick ejaculation is. So, can you explain to them in medical terms what that condition is known as? Because some people may experience quick ejaculation because of excitement, but it might not be that they have that condition.
Okay.
Do you understand? But they themselves, because of what they've heard on social media, they might now tag themselves as people who have such condition, even if maybe, I don't know how to explain that thing, but do you understand what I'm trying to say?
Okay. Now, what I'm going to say regarding the question I just asked is the fact that if you're a man and you're experiencing quick ejaculation, which simply means that it does not take time before you get rid of your semen out of your body. If you're having it,
like, what's the duration for it to be tagged as premature ejaculation?
It actually depends on your doctor's examination. So a gynecologist will be in the best position to answer this question. Okay. But what I'm going to say here is that if you have quick ejaculation as a man, it could be that, number one, it could be that, as I earlier said, that either overexcitement, anxiety can also be a cause of it. And yeah, those are some of the things that can also cause it.
And that might not really
mean
that
is your condition.
It could just be that is the situation that made it to happen that way, but that doesn't mean it's a permanent condition that you have.
Exactly.
So some of you need to go figure out what causes these problems for you. And that's why you see some people, maybe they meet a lady for the first time, they experience it. It happens based on excitement.
Yes.
But once they've become familiar, then they can go for 1 hour, 30 minutes,
Exactly.
2 hours.
Exactly. Now, let me make a scenario. If a man has never been used to sex before, maybe it's his first attempt, he will tend to have quick ejaculation.
Quick?
It will come very fast. Yeah, what will happen here is because maybe it could be the fact that he has not been there before. Just like you're traveling to Sokoto, you have not been there, you're not used to the weather. You have to adapt. So trying it for the first time, penetrating for the first time, one, you don't know what it means to penetrate into the vaginal canal. It's slippery now. So you don't have an idea about it, and that a lot could actually cause you to even release very fast. Pre-cum, you bring out the semen as fast as possible. So it could be the fact that some people are not used to it. That's their first time. It could be the fact that they are anxious, or it could be the fact that they're overexcited. So those are some of the things that can also cause that.
Now I'm not feeling for newly wedded couples that have never had something like that before.
Okay, and you know that people
that thing they called honeymoon.
Okay.
Imagine after preparing so much for it and it doesn't even last more than 10 seconds.
Okay, so the fact is that everybody's body, okay, is different. Your body physiology is different from my own. Okay, I could be the type that lasts for 7 or 10 minutes. It could be the one that can go for 30 minutes. So we are two different people. So I also believe that
I feel like
mindset is also one of it.
Yeah, what you are thinking about when
what exactly. So my advice for some guys out there watching me right now is that anytime you are engaging in coitus, I'm using that word coitus, which means sexual intercourse. If you are knacking, just tune your mind away from what you are doing. Just assume you are watching a football match somewhere. Tune your mind.
But how are you going to now get the experience? I think that's where a lot of people miss out. It's just like, I don't see the reason why anybody in this world should take the Viagra. I don't also see the reason why anybody in this world should get high to engage in something like that.
Exactly.
Because the moment you do that, it is not you anymore. It is the influence of that thing you've taken. Whether you like it or not, you are not getting the experience. And trust me, I feel that this is a mind game.
Yeah.
Because, and somehow, I feel like there's a way the mind can connect. There's what you call quickie. Do you know that as much as most ladies will say that they don't like something that doesn't last long, quickie is something that nobody can deny that they don't enjoy it.
Yes.
Do you understand?
Mindset.
That is because the mind is connected. They know that this is something that we need to do. So I firmly believe that you don't necessarily need something to influence you. Have that experience, no matter how brief it is.
Yes.
But then you need to also work on yourself, to know what causes you to experience it to be that brief. So that is what I would like us to talk about now. Number one thing you said is try to remove your mind.
Yeah.
Now, do you know that on the other hand, there are still people that find it very difficult to experience orgasm?
Okay.
Yes, they can go for so long and they would never achieve it. They'll now have to even start thinking about something else that can even make them to achieve it.
Okay.
So, this topic is two sides of the coin. No?
Exactly.
There are people that are struggling and asking that, God, I wish I could last long.
Yeah.
There are people where those people that are lasting so long, maybe it's because there's no emotional connection. Because sometimes when you really love somebody, it's hard to stay for too long.
Exactly.
Sometimes.
Exactly. Let me make a scenario. Imagine you meet a random girl you've not met before from the street. And maybe the fact remains that you're paying her for coming to see you. Then during the process, you'll be like, I'm going to kill her. Sorry for using that word. I'm going to finish her today. I will finish her. Yes, because you paid money to get that thing you're looking for. So some of them will make up their mind that no matter what happened, if it will warrant some of them taking Viagra or taking, excess of Viagra to perform, they will take it.
But I hope you know that's foolish.
And that's foolishness.
Because, I feel like these are the mindset of a poor man.
Yeah.
He may not really have experiences like this. And in fact, that's the reason why some men also force themselves on ladies.
Yeah.
Because when you are living a life where you don't lack things like this, I don't see the reason why you should tell yourself, I'm going to kill this person. Because you know that no matter how bad it is, you can always have it whenever you want.
Yes.
And this is another reason why God say abstain from immorality.
Yeah.
Abstain from it. So what you are saying now about a guy saying he's going to finish a lady.
Yes.
Does that make sense to you?
It doesn't really make sense.
It doesn't even make sense in any way, because whether you like it or not, there's nothing you can truly enjoy. I think that it is porn that is affecting those people, because people have watched porn. They expect that in every intercourse a lady must moan in a certain way. So somehow when they are not getting that feeling, they feel like they are doing something really, really magical. But you don't even need to penetrate a lady for her to moan.
Yes. That's why we have the limbic system. The limbic system is your emotional center. So that part of your system in the body that will make you to moan, to make you to cry during sex, is the limbic system. So what I'm trying to say in essence is that you might not even need to penetrate before a lady will start moaning. It can be clitoral stimulation, stimulating the clitoris. And the clitoris tends to be the most sensitive part of the female reproductive structure. Why? Because it contains sensory nerve endings. When it is touched, it is stimulated. The information, the impulse goes directly to the limbic system. And before you know, the girl start making sound. So that's how important the limbic system is. So the clitoris is very sensitive. Just like the gland of the head of the penis, the gland of penis, which is the head of the penis in guys, also have the same sensory nerve endings too. That's why we have tactile stimulation. A guy must not have sex before he feels satisfied. True touching of the penis and the head of the penis is enough reason to prepare the semen, the sperm, from coming out. And before you know, he's satisfied. It's like he's good. He feels better. So that's one connection with that.
Hope you guys are comfortable with this topic. Please, editor, censor all the sensitive words like sex, penis, and all those things, so that YouTube doesn't limit the reach of those videos. And please, if you like this, please let me know so we can have him again. Right now in the comment section, I want you to start writing down some of the questions you have so we can invite him again. Now, this is something a lot of people don't really think about. They think that for them to really, really enjoy, or for some people think that the idea of sex is pounding. What's your opinion?
Okay, the idea of pounding is not really necessary. Okay, it's not really necessary.
Is it okay to ask? I wish I could ask some ladies. No, that's not a very good thing.
Okay, the fact is that,
if not, I would have loved to hear some people's opinion.
Okay.
If pounding truly is something that,
okay, this is the
something
thing
that works for them.
Okay, the fact is that some people believe, especially some ladies, believe that pounding will make them to have orgasm on time. Okay, the intense penetration. The more you are penetrating, the faster you are penetrating, the frequency at which you are entering and coming out is enough reason to stimulate the vaginal wall. Like, if peradventure that pounding or the penis makes contact with the G-spot, before it's even the girl, if it's even the lady that will hold you tight, because at that particular time when the G-spot is touched, she's beginning to vibrate at that particular time, which simply means that she has actually reached orgasm. So at that particular point, you discover that the lady might want to grab you to herself, making sure that you don't pull out, because she's already at that sensitivity point of her life at that moment. So now, one thing that is also to be noted is the fact that during coitus, during sexual intercourse, the muscles of the vagina get swollen, like it increases in size, just to tighten the vaginal wall. That's why you discover that when doing coitus, doing sex, sometimes you discover that the penis is head firm. It doesn't pull out on time. Why? Because there is an impulse and information there that is causing the swelling of those muscles around the vagina. So it also happens like that too.
Now, there's this opinion on social media about ladies now.
Okay.
And we have so many young people who use social media. Social media is like their classroom. That's where they learn things,
Okay.
whether it's truth or it's false. Now, I like you to say it. A lady's this thing, V. Let me just use the word
Okay.
V. Some people say it's elastic.
Okay.
Some people say it's not. Some people use this word. It's offensive for me to use this word right now, but do you understand what I'm saying?
Yeah.
So, what is your opinion about it from the medical point of view?
Okay. Now, the muscle wall, the vaginal muscle, most of the muscles we have in our body, they are elastic muscles. So the vaginal canal is also elastic too. So the muscle is elastic. Now, for the fact that the muscle of the vagina is elastic, during penetration, it needs to stretch. Yeah, need to stretch. So there's elasticity in the vaginal muscle. It's elast. So some people say that, why is it that this person's vagina is so wide, like a river, that's so loose and all of that? Some fact could be that the person have given birth before. You know, some people who give birth, they actually tend to lose their vaginal elasticity and all of that. But at some point, some people also have it so tight and all of that.
There are some people that even after having birth, it might still come back. Yeah, it might even still be better
than those.
It might still be tighter. Sorry, it is the word better.
Yeah. It might be more tighter
than.
Yeah.
Then I want to ask another question, because I want the ladies to learn from this. Some ladies go to show. Some people even create fake accounts.
Yeah.
They go to vendors to buy products.
Okay.
Product that they tag V tightener.
Okay.
That they believe it can tighten. Some people even believe that there are some products that can make it be as though it has never been penetrated ever before. Do you believe that? Is it possible medically?
What I know is that it might be the content of that product. Okay, it might be the content of what that product is made of. But normally, the vagina is a muscle, so you don't even need all those things to tighten the vaginal wall. You don't need them. Yes, the way your vagina looks like, that's why it looks like. So you don't need any tightener. Just let it be the way it is. You don't need to stress yourself spending money because you want to tighten your vagina. It's not really necessary.
And I think some people's muscles are different. Some people's own is that no matter how many times they have that experience, it's always
remain. Exactly.
So any individual body is different.
Yeah,
right?
everybody's. But okay, fine. Do you know that the clitoris in some women tends to be different? Or the clitoris and the labia minora or the majora, the muscles around the vagina, it's the flaps. They are different. Some people, you see that the flaps is so big and long like a butterfly, and some people you might not even see it like that. So all the women, their body tends to be different. The physiology of their body tends to be different. Everybody is not the same. So that's another thing we also have to note as far as this section is concerned.
So, what advice do you have for married couples that are experiencing, they're not having a very good experience in their sex life?
Okay.
A lot of people are so timid to have these kinds of conversations. What is your best advice for them?
Okay, my best advice for those who are married, who don't find it interesting, or who are having problem with their sexual lifestyle, the best thing for you to do is, number one, seek medical attention. If that becomes a problem that really disturbs you all the time, you go visit your gynecologist. They're the one who specializes in the women reproductive pathways. So you talk to them, they will put you through. Then number two is communication between the two partners. You need to communicate with your partner before you even engage. You need to ask each other, how long do you want it? Communicate with yourself so that you can be in the same page before engaging.
Does it really work, or is more of the experience?
It's more of the experience. Do you get? Yeah, that's why I earlier stated when I was talking that it doesn't matter how long it lasts, but how well or how the experience feels like.
You know what I think? Destroyed a lot of has destroyed society.
Yes.
A lot of maybe somebody at the age of 14 starts watching porn and eventually gets married at 30 or 28. Do you understand the knowledge and experience this person has accumulated just by watching what they think should be the definition of a sexual experience?
Yes.
Do you understand me? Not just for guys, even
For ladies. Now, let me add something to what you said. You know, when you watch, you learn different things. Now, let me focus more on masturbation. If you're watching and what you learn from it is masturbation. As a guy, if you are frequently masturbating as a guy, you end up having low sexual drive, meaning that when you see a lady, a woman, it doesn't move you. You are not, before you know, you are out. Whatever she says does not interest you because you are used to one private lifestyle you are living. And when you are masturbating, sometimes it takes the sperm time to produce healthy sperm. When you masturbate, you are not expecting that in 2 days or 3 days, when you want to ejaculate again, your sperm will have good sperm quality. It will not. Sometimes it takes a lot, up to about 3 months or 2 months, for you to get back a healthy quality sperm, which is to say that if you are masturbating as a man, you might not have a quality sperm to get a lady pregnant. That's why you hear that, this man is having low sperm count. Your sperm count is low oligospermia.
You know, when you mentioned low quality sperm, I was thinking that the child will come out as somebody that doesn't know, that is not intelligent.
No, that's not what I mean.
Okay, low quality means unable to.
Yes, low quality sperm means that the sperm does not have good quality that will help to fertilize a good egg.
Okay.
When an egg is released during ovulation, exactly.
Okay.
So that will become a problem, and it might even lead to infertility. You'll be talking.
So those of you that are struggling with this, do not be shy. Tell your partner about it. The first person to tell his partner about it might just be the one to escape. And you'll be very surprised the person you are telling about it might even be struggling so badly with it.
Yes.
But because they thought that, you consider them so righteous to have approached them first, they may never be able to also tell you too that they too also struggle with it. So this is why it's very important to, build a very good relationship with someone before getting married.
Yeah.
A lot of people just jump directly. They already have this perfect identity that they've created of themselves, and they kind of expect their partner to see them as people who cannot indulge in certain things. I made a video about masturbation so many years ago. I don't know if some of you can remember. A lady reached out to me and said, "Lucky, do you know this was what ruined my marriage?" She said that when she was married, that no matter how hard the husband does it. That's why I'm telling you that.
Yeah.
See, it's not about pounding, based on what I've heard. The man who pound and pound and pound and pound, at the end of the day, he will achieve orgasm. The woman said that she never feels satisfied. So when the man goes to the bathroom, she just enter the bed, she'd use her hand to finish it.
Yeah.
Before she'll be able to achieve this thing. She told me that it's so bad that she owns a shop. She has like 4 staff. That she have to go to the bathroom every afternoon sometimes.
You see?
To even do it. It's that bad. The addiction has ruined her mind. And because of that, it has also ruined that thing called affection. She doesn't show affection to people. So she feels like she can stay by herself. In fact, if you see somebody that feels like they can stay by themselves, they don't need anybody, stop suspecting them.
Yeah.
Do you know why? Because God created us as sexual beings, and somehow we need people.
Yes.
So even if you have a partner who you are trying to touch your partner say no.
No.
I have to consent. You have to consent.
I'm tired.
First, or I'm not in the mood for something.
Yeah.
It's possible that while you are busy at work, they've already taken out time to do it themselves.
Exactly.
Or they are saving their body for another perfect day because they feel like that experience that they get themselves is better than giving it to you. I don't know how will I put this thing.
And I think that's the reason why I discovered that some ladies or women now buys vibrator, dildo, just to use and satisfy themselves. Like lipstick. And
if you are with a husband that don't have sense, Jesus, he would never know. You can even say, "Money, please bring my lipstick for."
Yeah, that's true, because you wouldn't know what it's actually meant for, the use of it.
There are some men who feel like social media is not for me. All they just talk about is God and work.
Yeah.
But what they don't know is that like there's a lot they can learn from
social media.
And please, advise you, communication has ruined a lot of marriages. Communicate. Do not let anybody shame you about anything. And some people should also know that there's a video I saw. A lady went to one church and she was saying something, and it was so shameful that somebody will come to a church to say something like that. Because what God told us is that we should not indulge in things like this until we are married. So how people can expect so much from something that was not meant for anybody to understand yet until that marriage has been established is so crazy. And then we have so many young people on social media who make videos. They'll just write the caption. They'll not be doing like this. I don't know if you've seen those
Yeah,
videos.
I've seen several videos like that.
And somehow you go through the comment section, somebody that does not have shame, doesn't care about anybody, will just comment something, and that comment have like 6,000 likes from the people who have shame and don't have the confidence to comment that same thing. And then you can now see that this reflects the minds of thousands of people, of young people.
Yes.
Instagram gives you the ability to see who likes a comment. So then you can go through the people who has liked that comment, and you then begin to see the profiles of these people. And not everybody there looks like a baddie.
Yeah.
Some of them are choristers in the church.
Yeah.
And this now exposes you to see, the hidden struggles of so many people. I pray that God will help everybody.
Just like an app called Tinder, right? When you get there, that's when you know that there's reality of life in the other side.
Okay, Tinder was established as a dating app.
Exactly.
But people saw that as an opportunity
for HKs.
For hookups.
Yes.
Do you understand? And to be honest, Tinder is still something that, it still works. So
yeah, it works. But
I've been on Tinder actually.
Okay.
And I think I would say I've met good friends on Tinder as well. So it then depends on the kind of Tinder. There's a way you do your profile, you hardly see certain kind of people.
Okay.
And even if you see those kinds of people, sometimes it's written on your profile short-term fun.
Yeah,
then you can know that those people are just only interested in fun. Yeah. So you can just decline, and then you get to see real people. Yeah. Like a lot of introverts use dating apps. Yeah. We have Bumble, we have Tinder. They're easy to connect. So when I came to Abuja recently, because I only got to settle in Abuja last year, August. Before now, when I came, I was always traveling the states of Nigeria, filming stories. I didn't have friends. After work, I'll just be in bed pressing my phone. Sometimes I'll be driving in my car the whole of Abuja aimlessly. And I have social anxiety. I don't know how to go to public places and just live a normal life. I'm always worried that everybody's looking at you, paying attention to everything you are doing, how you are eating and everything. So sometimes these apps are like the easiest way to connect and meet friends and even people like you. So I understand what you are saying, that app is not an app where people go to do, that's everybody's business anyway. The world has even changed. It's not even about this app. Do you know the one they call OnlyFans?
I've not heard about it yet.
It's not, Jesus! It's not about OnlyFans. Okay, this is Olamide. She knows everything. So, it's a platform now where you can actually pay, and then you get to see, you can even request that anything you want them to do for you, they'll do. So you are having like a very good, I don't know how to explain it. So all these things is ruining society so badly. Because if a man and his wife are having issues, knowing that he can actually get certain kind of satisfaction, because you see, the moment a man begins to make money, he feels like he can do whatever he wants. I know a guy who, when he didn't have a car, he never had in mind to approach any lady. But the moment he got a very small camera car, any girl he see will just blow her phone. I mean, like I don't know where he got this confidence from. Okay. So when a man has money, you know that there are ladies who are struggling so badly. Not that maybe they might be struggling so much, but because they know the value of this 10K, 5K accumulated by maybe 50 or 100 persons in a month. So you can pay them 5K, they'll have like a 30-minute section to do anything they want with you. So some people can even pay even more than that for them to do even worse than what is expected. So when you know that the money gives you this kind of access, it it destroys things. And then you see a carnal man getting married to a very good woman.
Yeah.
At the end of the day, the woman says that my husband has divorced me.
Yeah.
Because he doesn't have affection for her anymore. He feels like he has money. He also has, what's the name of pleasure. Too, so what does he really need her for?
Yeah.
His money can afford him a chef, can afford him everything. What exactly that's why I advise ladies, please, you have to be valuable.
Yes.
Live a life in a way that a man cannot even do without, in the sense that there's nobody that can easily replace you. Don't just be ordinary. Don't settle for ordinary.
Yes, exactly.
Be the kind of lady that gives a man peace, comfort. The way you, like, I don't know how to explain this. I'm not even, are you married?
I'm not married. I'm single.
We are not even in the position
we are not married.
This. So, people will say I've taken this interview from you. Sorry.
Okay.
Continue. But this is a discussion.
Yeah, it's actually a discussion. So, in general, please, young men out there, if you know your age of 17, 15, above 20, please avoid the intake of Viagra. It's not actually for you. If you know you are okay, please don't take it. Use your normal stamina, your normal strength, and go on with your normal lifestyle. Yeah. So don't go close to Viagra. You can even
take sex education classes.
Yes.
But not for, these are for people 21 years old.
21, yeah.
You need to start preparing yourself for that aspect, because you are a sexual being. So you need to start preparing yourself to know how to take care of your body. Somebody has a question, Latifa.
Okay.
You need to start preparing to learn how to take care of your body. You don't have to get married first before you start education. So learn how to understand how to carry your body, and understand how to take care of a lady's body. So Latifa said, what is the typical duration of sexual intercourse that is considered normal? Because a lot of people complain about their partner not lasting long, or people who complain that their partner do not satisfy them.
Okay. Thank you for that question. Now, when you talk about the typical duration for sex, we don't actually have a typical duration for sex. But one thing you must know at the back of your mind is that sometimes sex can last for within 3 to 7 minutes. It's very okay. What I'm trying to say now is that any man who can last within 3 to 7 minutes, that man is very, very, very okay. Nothing is wrong with him. Yes, nothing is wrong with him. It's very, very okay. Then the second one says, for those who don't,
it's one question. She just said, because a lot of people complain about their partner not lasting long. Okay,
now if the typical duration, let me say for example, the man lasts for 3 to 7 minutes. Within that 3 to 7 minutes, the man should be able to satisfy that woman at that particular time. That's why I told you it's not about how long. Okay, no matter how short the duration is, understanding, two of you should understand each other, and that will favor or foster that level you want to get into, cloud 9 or cloud 12, whatever you call it. Yeah, you can still get into that cloud with your 3 to 7 minutes man.
I think a lot of people don't understand what 3 minutes or 7 minutes is. 1 minute is you counting 1, 2 to 60.
Do you get?
And then you're counting it 7 times.
Do you understand?
So if you are having something like that and somebody is counting 1 to 60 first, not fast to
slowly.
That's 1
as
minute.
the second ticks.
But then of course there are people who can do something like this to 15 minutes.
Yeah.
I think this is why people say engage in foreplay.
Foreplay.
Just that there are some people that their mind is so weak that during foreplay, because they've watched so much, that idea, that thing they've seen of it entering inside is already,
in their head.
Just can't wait to
exploit it. Exactly.
Apparently, it's not really the way it is in reality. So, I think these are things that can actually make them to achieve orgasm faster.
Yes.
So, do you agree with what he's saying? Don't say yes.
Don't say yes. So, did you agree?
She's just don't say yes.
And another thing is that it's just for doing penetration. If the G spot is touched on time, before you know, even that 3 minutes is too long. Immediately it happens within 2 minutes or 1 minute. If the G spot is touched on time, you as a lady now, you start like.
And it's what you're saying might make sense.
You get
if a lady is touching herself, It's possible she doesn't even do it for more than 10 minutes.
Do you get? Yes, that's the fact.
It means that her brain already knows what needs to be touched.
Exactly.
But a man just wants to enjoy himself. At the same time, maybe also satisfy her. He does not know exactly what's to be touched.
Exactly.
He can only be lucky that sometimes he's doing it right, but maybe not perfectly.
Exactly.
But sometimes it can just go so perfectly, I don't know. But then sometimes this thing also has to do with people having too many
partners. Yes.
Too. And partners.
Yes.
So that's why there are so many things married people should. There's what they call role play. You understand? You can tell your wife that your wife is that agricultural teacher that wants to fail you. And then, no, I'm not supposed to discuss this.
Yeah, it's alright.
You know, there's this thing. There are so many things that people do just to create, just to, you know, to make it, you know, to make it fun.
Yeah,
or
to
like
spice
adventure.
up. Yes.
But of course, there are people who believe that this kind of topic is rubbish.
Yeah.
Maybe because they are Christians in a certain way that they feel like things like this should never be explored. The traditional way, you know, should be the same way it has always been. And you know what bothers me about this thing called is what people have turned it into. Do you know I never even knew what they call hand job and
blow job and all of them.
A certain point in my life.
Exactly.
There were certain things I never knew on time.
Okay.
I never even knew about those things.
And the funniest thing is that, do you know that even from blowjob that most ladies practice. Now imagine a lady meeting with a man that he does not know, a random man. Imagine the man is maybe having a viral infection, for example, herpes virus, and through the process of doing that blowjob, and this virus can be transmitted through the semen. She swallows the semen or licks it and all of that, and before you know it, she gets the virus into her system. Some of them will go to the extent that if it is human papillomavirus, it will not affect their tongue and their throat, causing infection. Some of them will cause them infection, like it can cause them viral tonsillitis. Yes, tonsillitis simply means inflammation of the tonsils. When you pick up your mirror and you open your mouth and stick out your tongue, you are going to see some tooth-shaped oval structure at the back of your throat, like this. Those are your tonsils. When they are inflamed, they'll come and block towards your airway. By that time, you begin to discover that you start snoring. You don't snore before. You start snoring. You start breathing through your mouth instead of your nose. Difficulty, things like that start setting in. And what they will do for is just to remove the tonsils, which brings about tonsillectomy surgery.
Does it work?
Yeah, tonsillectomy surgery works. So when you have it, they will remove your tonsils. Sometimes it could be a bacteria that causes it. If you're not always washing your hands, you touch surfaces, you put it in your mouth. People, you know, some guys or some women always like cutting their nails with their teeth. So you can even take this bacteria into your system.
And this is not just for ladies alone. Even guys that also do
exactly.
What's the head?
Yes, it's not. Now the vagina is acidic in nature. The woman's vagina is acidic in nature. Why the semen is alkaline in nature. Now imagine a man giving a woman head. The saliva itself has acid content. So imagine using your tongue on a woman's vagina, or in the name of trying to please her. It can trigger infection in the woman. The woman will end up.
The man too?
Do you get the man also? We have the same thing. So spread of infection everywhere. So it's not actually advisable that all those things are even be. It's not necessary that you must give a blowjob to a man or the opposite before people feel better and all of that. But it depends. If you want to practice that, if that works for you or if that favors you, make sure you go to the hospital and do your test and get screened of viral infection or any kind of bacterial infection, so you don't get yourself infected. There's a married couple that love it, especially blow. Some married couple love it a lot. So what will you do? You need to screen yourself so you don't end up getting yourself infected.
Maybe this is the point of conversations like this. This is why people should watch the Locudo experience.
Yes, very, very important. I've been watching it when I was in Calabar. I was in 200 level when I was there watching your videos.
Thank you. Appreciate it. So you get to learn a lot. Trust me. There's no platform in Nigeria that is like this. So
yeah.
I don't know if people are just ignoring this platform. You guys should be helping me share my platform. Please share it to people. If you make videos online, you can just get some episodes, just react about it, talk about it, so people can know about the luckydududavid experience. Those of you that are always telling your partner to do head for you, you have to be more considerate.
Yeah.
Because, and I feel for so many young people, because the kind of things they get exposed to, peer pressure.
Yes.
There are some people that all their life they've never done that,
it
but
before.
because they've been hearing about it, even if the guy does not want it, before you know, they don't kneel down.
Yeah.
They don't come out.
Okay. Something just.
Somebody wants to ask a question.
Now something just came up now.
Okay.
Imagine a lady telling you that, I love it when you use ice cream. You rub ice cream on my stuff, on my V. Put ice cream there, then begin to give me head.
Bro, how do you know this one? Talk truth.
No, I'm saying it because I've heard it.
From where?
I've heard it several times. Those are what is coming up now, and very soon they'll become popular on the internet. Like, you start seeing them happening. That in case you are, because some people believe the fact that the vagina have some kind of smell. There are some ladies that will be working with infection, maybe bacterial vaginosis.
I think we should also talk about it too, right?
Okay, some ladies will be working with infection, bacterial vaginosis, to be precise.
Let me ask this question in case you want to repurpose the video.
Okay.
No, I don't want to be the one to ask this. How do I ask it? I don't think it's appropriate for me to ask.
So
okay, you just talk.
Okay, so there are many content I've created a content where
No, just talk about it.
Okay. Now, for example, if a lady is having bacterial vaginosis, okay, let me assume a lady has an infection, and because her vagina is smelling, bringing out offensive odor like rotten egg or fishy smell. Yeah, those is the typical description of bacterial vaginosis. What it means is that the vagina have a natural bacteria inside. Okay? A natural bacteria inside. Now, if the bacteria in the vagina become an overgrowth, that what brings about this particular infection called bacterial vaginosis. So the presentation is that the lady's vagina is going to be that smell like a fish or rotten egg. You see that some ladies will go all the way far to buy oil perfume to start applying so they can smell nice.
But it doesn't work.
It doesn't work.
So what works?
And it worsens it. What works is for you to go to the hospital, run a test, see your doctor. Your doctor prescribe medication for you, and it clears off. It clears off everything, and you are clean and fine again. But a lot of people don't know how this is, because if you have infection, it's not treated, it can affect your fertility as a woman. Yes, it can affect it, and you might end up not even seeing your period anymore. Some women can stay for like 2 months, 6 months. They don't see their period. Why? Because they're already having infection, which is untreated.
Now, I want to ask something. The way the vaginal smell, is it possible for somebody's throat to also smell that way after maybe you've had oral?
Okay, fine. Have you heard about tonsillolitis before?
No.
Tonsillolitis simply means tonsil stones. I told you about the tonsils. They are the two oval-shaped structure at the back of your throat. They work as immune system. They are part of your immune system in the body. You have it. Every human have it. Now, if you have a tonsil stone, one of the presenting symptom or sign you will see is what we call bad breath. You start having bad breath. Halitosis. That's the medical name for it. Halitosis. You start having bad breath. So if a man is infected because of the fact that he did blow to a woman. Yes. If he end up gets maybe a bacterial infection or a viral infection that affects the tonsils, causing tonsil stone, definitely you're going to be having, you'll be afraid to talk. If you are talking, you're covering your mouth with a handkerchief because it's smelling, the breath is bad. It's bad. So you can get that
those
too.
kinds of people should also seek medical.
Yes, you see, that's why we have the ENTs.
Ear, nose, and throat.
Otolaryngologist.
But there could be other things that could also cause.
Yeah, there could be other things that could cause that too. But basically, in case you have stuff like that, you see your ENT doctors.
Do some examinations.
Yeah, do some examinations.
And also help you.
And the important thing, the most amazing thing about ENT is that they'll first of all check, if you are complaining of throat now, they first of all check your ear first. They check your nose. They check your throat. Because all of them, they are linked together.
Now, I want to ask this question about ladies' hygiene.
Okay.
For some ladies who experience foul smell down there.
Okay.
What I mean foul, it means something unpleasant.
Unpleasant smell, yeah.
Now, it might not be because they have infection, it's possible that maybe their lifestyle,
Poor hygiene.
choice of clothing.
Yes.
And I also heard from a friend that a lady is supposed to change her underwear 3 times a day.
Yes.
I don't know if she was exaggerating.
Okay, fine. Let me say something. When it comes to hygiene relating to ladies, maybe let me assume vaginal care. A woman is actually meant not to be wearing, for example, some women like wearing tight undies for like 12 hours, 6 hours, depending on their work. Now, a lady is not even meant to be wearing tight undies for a long period of time. Why? Because that will also it can trap heat. Nowadays, I've come to think that most ladies prefer black color. So most ladies, their undies are black, and black is a good absorbent of heat. It absorbs a lot of heat. The vagina does not need that. Does not need too much heat
So
there.
they should wear white.
At least white is good.
I'm sure this is not your personal
It's not about personal anything, but I'm just saying it because
opinion.
yeah, because I remember very well that when I was still in school, I did physics. We know what black color can do.
I understand.
Yeah.
I was just joking.
Yeah, so that's it. So regarding that fact, it should be that they should be changing their undies more frequently. There's somebody that can wear undies for 2 days, like the way a guy can wear undies for 3 days. Like, guys, we don't normally care. We can wear our boxers for 3 days as far as nobody is seeing us. We are comfortable with that. So some ladies also do that, but it's not advisable.
Remind me of university days. There's this guy that will wear it for 2 weeks.
Okay. So it's not if you try to do some findings, it might not be his fault though. Some people
just care less. Some people do not understand. There's this transition from childhood to teenage
Yeah.
to then adulthood, right? So some people don't know when they finally transition. So they still keep living the life that they've always lived. Do you understand? But then they forget that their body is now changing. Maybe as a child they could wear something repeatedly, and it might not give a certain kind of smell. Or maybe it might, but their senses are not aware of it.
Okay.
So then they continue that lifestyle even into adulthood.
Yeah.
Until somebody brings it to their notice and say, Emeka, why are you living a very dirty life? So then for ladies, how often should a lady change her wardrobe, the undies wardrobe?
Yeah, it depends on her.
And then how many undies should a lady even have too?
I can basically not answer that. Why? Because number one, I'm not a lady. That's number one. And at least as a lady who is practicing good hygiene,
28.
do you understand? Maybe you're 28 or whatsoever, like you should at least have as many undies as you want, so that you can be frequently changing them.
It conveniently.
Yes. Don't allow somebody to tell you that, that girl, her best undies is pink color, because they already noticed that you're always.
Even if it's pink, it can be pink. You can
plenty pinks, and all
pinks.
of that. But some people will not think that way. They might assume that it's only one pink.
What's it concerned? No, bro. Jesus Christ.
So that's it.
Who is seeing all those ones?
So that is one thing.
Who looks at things like that these days? Online.
Some people don't mind their business. That's the truth.
Oh my god.
Yeah, some people don't mind their business. And another thing I would like to add in addition to what we are discussing is the fact that there's something we call have you heard about this what do we call it? Do you know the testes? Testes. The testicles in men.
Yes. That round thing.
Yeah, the two balls. It's very sensitive actually.
How?
Yeah. Meaning that thing is not even meant to be played with anyhow by a woman. Yeah.
It's fragile.
Yeah, it's fragile. Apart from that, the reason why I say this is because what is holding the testes in that sac, that scrotum, the sac that houses that they are found inside is called the scrotal sac. So what is holding those those testes is called the spermatic cord. So sperm flows through there into the testes. So what I'm trying to say in essence that peradventure a lady plays rough and twists your testes, it might end up twisting the cord. Just like you have a rope, a thread, you twist the rope or the thread together, it can cause trauma. And before you know it, you see yourself in the hospital. So if a lady is practicing or whatever is being called, at least let her be avoiding that particular area. What you saw there, the testes were not actually there naturally. They were formed in your abdomen.
Please, we are not promoting.
Yeah, we are not promoting. Yes,
Sexual behavior.
this is just for educational and informational purpose only. Yeah. So it's not advisable ladies even play with the testes anyhow, because
it's a very delicate. I saw a video of a lady holding Jesus.
Do you get?
That man is dead.
Why do you think that if a lady hits a man in between his leg, the man will fall down and try to, oh God, my pain. Do you get? Because that thing is very sensitive. Very, very sensitive.
Please, I beg, I don't. Because I'm just like, you're just imagining a situation where maybe something hits it.
Yeah.
But the brain is so fast that before it even gets there, you've closed, yeah. You've closed your legs and everything. Yeah. Just like the way if something's coming to enter your eye, your brain is smart enough.
Exactly.
It just already closes it immediately.
To blink the eye.
It blinks it.
More just like a reflex action.
Reflex action.
Yeah.
At just the dying point where it's supposed to even enter the eye.
Yeah.
Just as sometimes it doesn't still enter the eye sometimes. Sometimes it just hits the eyelid. Yeah. That's the
and follow. Maybe it could be an insect.
It could be an insect that it don't confuse you. It just feels like it entered, but it didn't really enter. So the brain is really smart, but please avoid those kinds of things. I beg. I use God to beg now.
Avoid it.
Those things are not okay. And again, if you know that your partner love weird things, please try your best to help your partner. Yeah. I was talking to a friend who was telling me how her boyfriend exposed her to so many toys. Okay. And now her body has become used to it in a certain way that she feels like it stimulates or helps her to enjoy it. So if she's now having such experience without those toys, it feels like something is missing. Okay. Yeah. So, and eventually, if a woman like that gets married and she's shy enough, she's very, very shy to discuss something like this with her husband, it begins to cause trouble. So, this is an opportunity that there are so many professions in Nigeria, but unfortunately, we don't get to talk about the importance of these professions. There are certain people you can actually see. I don't know if they are therapists or who are they. There are people that can actually counsel.
We have psychologists as well.
Okay, psychologists.
Yes, we have psychologists. A lot of them.
Does gynecologists speak about things like this?
Yeah, the gynecologists work with women. Okay. Yeah, that's the major focus. That's the major area of interest.
People should try. If you love somebody, try to talk to them. Yes. And please, human beings, we should try to let's train our minds to be humble to learn. Yeah. Certain things are meant for our good. Some of you are very confident that if you don't see somebody that likes this thing, you will never be with that person. You don't know what your fate will look like. Some of you might spend the rest of your life alone. Do you understand? So please, I'm using this opportunity because we've had this topic to also talk about this thing. Some people be like, if they want to marry, they will marry. They'll prefer to be with somebody who smokes too. Yeah. To avoid discrimination. What if you start practicing how to let go of smoking? Since smoking is not something that is widely acceptable. Yes. There are certain people now that, they are accustomed to using toys to stimulate the sexual experience. So they prefer to have somebody who also shares the same mindset. What if you start practicing how to detach yourself from things like that? So that way, if you meet somebody like that or you don't meet somebody like that, you are safe.
You can see,
there's a lot to talk about, but unfortunately, we have limited time. The camera's battery is getting low. Hope you guys enjoyed this episode of the Luckydududavid experience. We are going to be having another topic. Okay. What other topic are we going to be having?
We can talk about a girl using hanger for abortion. Yeah.
Which other one again? I don't like that one.
We can also talk about hepatitis and kissing disease, infectious mononucleosis. That's one thing people think it does not exist. Yes, kissing disease.
You can actually get disease from kissing.
Yes, you can. Okay, it's a viral infection actually caused by the Epstein-Barr virus.
Which other one can we talk about again?
Okay, or we can basically talk about, I think, what again? Eating disorder that can affect ovulation. Like the anorexia nervosa is a type of eating disorder. We also have the bulimia, also type of eating disorder. It affects women too. Yeah.
Yeah, what else?
Yeah, and people that use it like a man, when a man urinates on a test strip.
Why will a man urinate on the test strip?
Some people like practical now. They like experience.
I beg you.
They like experiments. Like,
That's so
let me
weird.
check what
Check
is
what?
going on. Do you understand?
God forbid.
But the fact that does not actually bring out the actual thing.
That man go dey
Unless
piss
you go
for-
to maybe to the hospital to do a scrotal ultrasound. Like,
Okay, it's a topic we're supposed to talk about. Some people are taking sexual experience to another height.
another height.
We now have oral. We now have the other one that I cannot even mention, but I'm sure you know it.
Yeah.
Don't mention it too.
Okay.
There are certain things I don't really.
Because there's something I would have loved to talk about is
What's
the
that?
other one. That the dog we know.
Which dog?
You know now, our dog now.
Dog do those things.
The dogs we have, if you have oral or the oral other one, we also have the anal other one, and that one is very dangerous. Why? Because there's one bacteria that is inside there. That's where it lives. The bacteria lives there.
Oh, sorry guys. There are certain kind of topics that it just makes me feel like, oh boy, I'm about to pass out. I don't know, like, I don't know. It's just
Yeah. At least your viewers might love to.
no. Please, not here. I'm not okay for that.
Okay.
If I want to do it, I'll just ask you the question. I'll set the camera.
And you
then I'll
run.
leave it. When you are done talking, you call me. And I say, okay, guys, thanks for watching this episode. The audio version will be uploaded on Spotify. And then I don't vamoose with
Oh.
that. So, like I said, some people are taking sexual experience to a very great height.
Yeah.
You see some ladies. I saw a lady that was using mortar pistol. It's not even
Yeah.
so. I interviewed a lady that said she was using. That place is
And yeah, it's peaceful now.
she was into.
And some people even use bottle.
Okay.
Yeah, some people use bottle. There's one that use
I saw a video like that on
one
Telegram.
use a powder container. This passion
Perfume
powder,
called
and it breaks.
body spray.
It breaks into two. One part left in the vagina, another part was outside.
Jesus.
Yeah, that was how painful it is. In such situation, they're basically supposed to at least give her maybe a local anesthesia so that when they are removing it, she doesn't feel the pain. But at this particular time, they can just remove it like that, so that at least she will learn a lesson. Next time, she won't practice it again. Yeah, things like that happens.
Even some guys that are masturbating, there are certain things they are now used to, like everything that looks slippery to them.
Yeah.
Some people are even buying ladies that looks like mannequin. Anyways, our battery is so low, we have to conclude. Thank you so much for watching this episode of the Luckydududavid Experience. The audio version, as usual, is going to be uploaded on Spotify. So go to Spotify right now, search the Luckydududavid Experience, and please, I'm begging you guys, if you love this platform, keep supporting it by telling your friends about the Luckydududavid Experience. If you make videos on TikTok, you can make a video about the Luckydududavid Experience, a particular episode you watch. Please help us to build this platform. Help us. Thank you so much, guys. And we are going to be seeing more episodes from him. If you like him, indicate in the comment section. Share to like 100 friends, 100 different groups.
Yeah.
And let's say bye to the viewers.
Thank you.
Thank
Bye.
you, guys, and bye.
Yeah.